Okay. All right, and Emily's going to be monitoring the chat box. So if you have any questions, go ahead and write them in there, and we will address them kind of as we go and at the end as well. Okay, so at Mid-Columbia Children's Council, we recognize that these are unprecedented times as the United States responds to the COVID-19 pandemic. We recognize the unique role and contributions that high-quality early childhood education providers play. Numerous studies have proven the effectiveness and impact of high-quality early childhood education. While this pandemic has certainly affected our daily lives, we cannot simply toss aside years of research, evidence, and efforts. We know that this crisis will have substantial impacts on the mental health of many, including that of children. Therefore, it is now more important than ever that we provide our children with services that excel in health, safety, and quality. We are committed to supporting you, the employees who continue to provide quality care and education for children as Oregon and Washington continues to manage COVID-19. We are continually monitoring conditions throughout the states and the guidance which has been provided by the governors, the Oregon Health Authority, Washington Department of Health, as well as local health departments to ensure that our programs are compliant and safe for staff, children, and families. We are aware of the high stress environment that we have been encountering the last few months. These changes can be overwhelming and can cause uncertainty, but our commitment to support children and families remains the same. Creating routines and building school families can be helpful as we move forward in these times of uncertainty. No matter what role you play at Mid-Columbia Children's Council, you are an essential part of our agency and our mission. We highly encourage you to reach out for support when you need it and practice self-care strategies. This might include taking deep breaths, going for a walk, or reaching out to a coworker or your supervisor. In March of 2020, Governor Brown and Washington Governor Inslee ordered that all childcare centers be closed. As we move into reopening our centers to serve children, we will follow recommended guidelines centers must take to reduce risks to staff, children, and families of exposure to COVID-19. Everyone will find that there are adjustments to how we do our work together. At the same time, our core mission and the importance of maintaining caring, safe, and secure learning environments for children remains the same. We are committed to upholding the highest standards of safety for children, families, and center staff members. To meet new standards from the Office of Child Care and the Division of Children, Youth, and Families, we have made changes to some of our daily procedures and practices. In this orientation, we will provide a high-level overview of important changes you need to be aware of. More detailed information about specific operations in your center will be provided by your area manager and center coordinator. We will look at basic information about COVID-19 and steps everyone should take to protect themselves and others. We will examine the steps we're taking to reduce health risks to children and staff, as well as the ways we are trying to support children, families, and each other in these times. So today we're going to be going over coronavirus basics, reducing the risk of exposure, daily arrivals and departures, daily health screenings and attendance, exclusion, and working with families. So the novel coronavirus known as COVID-19 is a virus strain that has only spread in people since late 2019. Health experts continue to learn about the virus and how the virus spreads. The primary ways in which it is spread from an infected person to others is through the air by coughing and sneezing, close personal contact, such as touching or shaking hands, and touching an object or surface with the virus on it, and then touching your mouth, nose, or eyes. People who have been diagnosed with COVID-19 have reported symptoms that may appear in as few as 2 days or as long as 14 days after exposure to the virus. Primary reported symptoms have included cough or difficult or labored breathing or a temperature of 100.4 degrees or higher. People who are over the age of 65, pregnant, or who have underlying health conditions, including those with a compromised immune system or respiratory conditions like severe asthma, are at a higher risk to develop complications from this virus. We strongly suggest that such employees first consult with their medical provider and supervisor before coming to work. For all workers, regardless of specific exposure risks, it is always good practice to maintain social distancing at work to the extent possible. Limit close contact with others as much as possible and maintain more than 6 feet of separation. Practice good respiratory etiquette, including covering cough and sneezes. Frequently wash your hands with soap and water for at least 20 seconds. When soap and running water are unavailable, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash your hands that are visibly soiled. When in public and at work, wear a face covering or one of the MCCC provided face masks. Avoid touching your eyes, nose, or mouth with unwashed hands. Avoid touching or adjusting your mask. Clean and disinfect surfaces, particularly high contact areas, frequently. Avoid close contact with people who are sick. If you come into contact with people who are presumed or confirmed to have COVID-19, stay home and notify your supervisor as you need to self-quarantine. Do not come into work if you are experiencing symptoms of COVID-19, including frequent cough, sneezing, fever, or difficulty breathing. Seek medical advice and testing. Now we'll go into reducing the risk of exposure. COVID-19 has not only changed the way of our life locally, but also across the nation and around the world. As we provide essential early childhood education services to children and families, we are committed to ensuring our environments meet the very highest standards of safety. As local, state, and federal level regulations recommendations have changed, we have adjusted our own policies and procedures to match these regulations and keep children, families, and staff members healthy and safe. A number of our procedures have changed, in particular how those around how we set up our environments and how we make sure our environments are kept clean and disinfected. In these next sections, we will share with you how you can keep environments safe and what tools you can use to do so. If you ever have any questions or notice any obstacles to safety and sanitation while you are working, please connect with your center coordinator or area manager. Ensuring safety is a team effort, and we will need the help of every person to make our system work well. We want to thank you in advance for the dedication and care you provide in working to follow these procedures correctly and for keeping children, families, and staff members safe. So we're going to start by reviewing the definitions of cleaning, sanitizing, and disinfecting. Do you know the difference between the three? If you are sitting in a group, take 3 minutes to discuss with your team the difference between the three. And then I'm gonna ask you guys what you think in the next slide.
Cleaning the surface for any like soiled areas, dirty areas, and then sanitizing, using something to sanitizing and disinfecting seems to go hand in hand. What do you think?
Okay, so I kind of talked about how you can use your annotations yesterday. So if you can use your annotations and use the typing or the text module, you can write in your answers here. Okay. So first is always cleaning. Cleaning physically removes, oops, hold on. I'm gonna erase what you guys wrote so you guys can see what I'm doing. So first is always cleaning. Cleaning physically removes germs and dirt from surfaces or objects. Cleanings must occur first, since many chemical sanitizers and disinfectants won't work if a surface is dirty. Cleaning does not kill germs, but it does help to remove them. Sanitizing, oh, is it not going? 1 second. There we go. Sanitizing reduces the germs on surfaces to levels that are considered safe, but does not totally get rid of them. Sanitizing is most often used for classrooms, food services, and kitchens. Disinfecting destroys most germs. Oops, there we go. Disinfecting destroys most germs and prevents them from growing. Disinfecting is most often used to clean up bodily fluids and for bathrooms and diapering areas. Because disinfectants are harsher than sanitizers, they are not always safe for food contact surfaces. It is important to know what surfaces must be sanitized and which disinfected, and which chemicals do each. Before either step, surfaces must be cleaned because residues, including oils and dirt, can prevent sanitizers or disinfectants from working. Before you sanitize or disinfect, you will always need to first clean a surface, even if it doesn't look dirty. That's because there can be dirt that isn't easy to see, and sanitizers and disinfectants will always work better when used on a clean surface. A mixture of soap and water is used for cleaning. Here are some basic instructions on how to clean a surface. Be sure to follow guidelines for the mixing ratios. Make sure you are wearing disposable or rubber gloves. Hold the bottle about 6 to 8 inches above the surface area and spray, making sure to cover the entire area. Thoroughly wipe the area, removing all dirt and debris, and then wipe the surface dry with a paper towel and throw it away. Here are some general instructions on how to sanitize or disinfect a surface. After you have cleaned the surface, make sure you have gloves on. They can be disposable or rubber, and you may use the same pair of gloves that you used for the cleaning. Follow the instructions for cleaning the surface. Spray about 6 to 8 inches from the surface, covering the entire area. Allow the surface to air dry when possible, or wipe the surface dry using a paper towel after letting it sit for 2 minutes. Indoor and outdoor play areas and playgrounds are wonderful places for children to explore, learn, and grow. To maintain a clean and healthy environment and prevent the spread of harmful bacteria and viruses, centers will routinely clean and sanitize indoor and outdoor play areas. The indoor and outdoor play areas at our centers contain many different types of equipment, structures, and toys. These new procedures apply to a broad range of items, equipment, and structures. Should questions ever arise regarding the cleaning, sanitizing, or disinfecting of particular items, please reach out to your center coordinator or area manager. Teachers will continue to provide outdoor and indoor activities when possible. The center must create an individual outdoor and indoor schedule in which each group of children has an opportunity to enjoy separate outside times daily. The center must designate a person to clean and disinfect play structures and toys each time they are used by a group of children. The classroom environment is one that needs ongoing observation and attention to detail. Changes to classroom environments will help ensure that they are clean and safe places for children to learn and play. For example, you may want to spread out furniture to allow for more space for social distancing. Items that cannot be easily cleaned, such as soft or porous materials, should be removed. Sensory tables are not to be used until further notice. Take a look at this picture of a classroom and imagine that it was full of children. What would they be doing? What would they be touching? And what would you be doing to help the environment stay clean? So in your groups that you're sitting with, take a few minutes to talk with your team about other ideas that you can do to help children stay safe in the classroom. And we're going to use our annotations again. So if once you have an idea, go ahead and use your text annotation to type it on there. soft unwashable surfaces, teach about germs, remove porous materials that cannot be disinfected. Those are all good ideas. Someone from the summer program probably has a good idea of what worked and didn't work. So if there's any insight from anyone who did our summer program. Writing material should be, oh, I didn't finish. Remove the color from the table.
Emily, white salmon
says.
Yep.
Thanks, Emily. I just saw it too. Limiting the children in each area. Teaching students about physical distancing. Individual bags of materials. Yeah, those are all good ideas. I'm going to go ahead and erase these so we can move on. And we just went over this one, so we're going to go ahead and keep moving on. So one thing we recommend you do while you are in the classroom is to pay attention to surfaces that are frequently touched. What are you touching as you move throughout your day? What are other staff members touching? And what are kids touching? Some items may need to be cleaned and sanitized or disinfected more frequently. This includes high-touch surfaces in the classroom and around the center. Typical high-touch surfaces that could transmit viruses and bacteria include light switches, tables, chairs, doorknobs, countertops, handles, phones, toilets, faucets, and sinks. The more frequently items are touched, the more germs they are exposed to. By keeping high-touch surfaces clean and sanitized, we can reduce the chance that they will spread disease when people touch them. If you ever notice that a surface is visibly contaminated with bodily fluids such as saliva or mucus, clean and disinfect the area right away. Throughout the day, collect toys as they become dirty and remove them from the play areas. Toys that have come into contact with a child's mouth should be removed immediately after use. Place the dirty toys into containers and away from children until they can be washed. When you go to clean them later, it can be helpful to have different containers, one for cloth and stuffed toys and one for wood and plastic toys. At the end of the day or at another specified time, such as nap time, clean, rinse, and sanitize the toys. The first step of cleaning is actually the most important step, so make sure you do it well. Sanitizers work best when the surfaces you use them on are clean. Toys can be cleaned by hand, in a dishwasher or washing machine, depending on what is most appropriate for the toy. Make sure the toys are fully dry before returning to the child play areas if children are still present. For cleaning soft or porous surfaces such as carpeted floors, rugs, and drapes, remove any visible contamination and clean with the appropriate cleaners meant for use on these surfaces. After cleaning, if the items can be laundered, launder them in accordance with the manufacturer's instructions using the warmest appropriate water setting for the items and then dry them completely. Otherwise, use EPA-approved products that are suitable for porous surfaces. Check with your center coordinator or area manager if further instruction on what products to use. If laundering is not readily available for daily use, an approved plan will be put in place. Cleaning linens includes items such as sheets, aprons, and towels. Before you do laundry, put on disposable gloves. As you handle the dirty laundry, be careful not to shake it, as this can spread the germs. Follow the manufacturer's instructions for laundering while setting the water temperature to the highest appropriate setting. Make sure your clean laundry is dried completely before removing it from the dryer. Collect dirty linens in washable bags that you can wash along with your dirty laundry, or use plastic laundry baskets that can be cleaned and disinfected after each load of laundry. When you are finished touching dirty laundry, remove your gloves and wash your hands. To maintain a clean and healthy environment and prevent the spread of harmful bacteria and viruses, toilets should be disinfected or sanitized frequently. Separate groups should have their own bathrooms and should be kept separate from other stable groups. Where this is not possible, clean and sanitize bathrooms each time they're used by a group of children. The center must designate a person to clean and disinfect the bathroom each time they are used by members of different stable groups of children or when visibly soiled. For electronics such as tablets, cell phones, CD players, keyboards, and walkie-talkies, follow the manufacturer's instructions for cleaning and sanitizing. If you do not have instructions to follow, use sanitizing wipes or sanitizing spray. Never spray a liquid sanitizer directly onto electronics. Instead, spray the sanitizer onto a paper towel and then carefully wipe the surfaces. Dry electronics thoroughly after sanitizing, remembering the 2-minute wait time. So this is a lot to take in. To help us meet all of our safety requirements, we have developed a cleaning, sanitizing, and disinfecting schedule. Recommendations for what to sanitize and disinfect and when to do it are based on the Oregon and Washington regulations as well as CDC recommendations. This cleaning schedule will be your go-to reference for maintaining sanitation in the classroom. A copy of it is available at all of your sites for you to refer to. So you will notice that there are sections on the schedule that reference different areas of your center. The first section of the table highlights classroom areas. Take a look at the first item, doors and cabinet handles. You will see that you will need to clean and disinfect them every day. In the comment section, you will see that the recommendation is that this is to be done at the end of the day. You will also see an asterisk at the top of the X. This tells us that it's a high-touch surface that may need to be cleaned and disinfected more frequently than once per day. Oops. For the second item, oh, I'm sorry, I went too fast. For the second item, the drinking fountains we see, they also need to be disinfected every day. But in the comments, you can see that it is recommended that we not use drinking fountains at this time and that we use personal cups or water bottles instead. This example speaks to the fact that there are many considerations to be made for the procedures at each center. Area managers, center coordinators, and staff members will need to actively engage with one another and communicate about sanitizing and disinfecting. As we navigate new ways of keeping children, families, and staff healthy, please make sure you have all the information you need to do your job correctly and to always ask for clarification when you have a question. So I want you to take a few minutes to review these. If you do have them available, take a look at it and see if you have any questions that we can go over as a group before we move on.
While you're waiting on questions, Wendy did have a
okay.
suggestion in the chat box that said, take all of the things that children use to write, draw, cut, etc., and have them in their own separate little bags with their name on them so they don't use the same supplies.
Mm-hmm. That is a really good idea, and I think that's something that the summer programs were able to implement. So I have this empty slide if you want to use your annotations to put any questions that you might have in here. Or you can put them in the chat box. So the first question is there a list of recommended products for disinfecting and sanitizing? So right now we're still going to just be using our bleach solutions. I'll give you guys another minute. Okay, if there's no more questions, I'm going to keep going. So we're going to talk about supporting transition between groups. Cleaning and sanitizing play areas and toys multiple times a day is a big undertaking. To simplify transitions between groups during operating hours, consider implementing these strategies. Limit the equipment and play items offered for each group of children while taking care to offer enough items to minimize sharing between children. For example, instead of offering tricycles, large blocks, balls, and wagons, offer just tricycles and large blocks for a play session and aim to have each child use a separate tricycle if possible. Create a way for classroom staff to communicate what items were touched and played with to a person who cleans and sanitizes in between groups. A checklist of items and areas or laminated picture of the playground that is marked with an eraser marker are 2 suggestions. Remove or block off items or areas that are time-consuming or difficult to clean. Bring items that are easier to clean, such as dolls and other toys, and replace removed activities if needed. Apart from routine cleaning and sanitizing of play areas, there are other practices that can help reduce the risk of transmission of disease and exposure to bacteria. Have children wash their hands near the time they will be entering the play area. For children 3 years and above, consider use of hand sanitizer before accessing the play area. As in the classroom, staff should disinfect any areas contaminated with bodily fluids immediately. Have cleaning and sanitizing supplies on hand outside whenever children are present, taking care to keep them stored away where children could knock them over or access them. Toys that come into contact with children's mouths should be removed directly after use. Keep bins for collecting dirty toys outside and ensure they are kept away from children. In both Oregon and Washington, MCCC is requiring all staff to wear a face covering while they are with children. We will provide center staff with disposable masks. Disposable masks should be changed after lunch, throwing the old mask away and putting on a fresh mask with clean hands. The purpose of the mask is to limit the spread of the virus. Use of the mask limits the water droplets expelled from the mouth or the nose of the wearer. Research currently suggests that wearing masks is about preventing people from spreading the virus. While children are recommended to wear face coverings, they will not be required to at our centers. Parents can decide whether or not they want their child to wear a face mask while at school. Children will not wear a face covering during nap time, and children under 2 years old should never wear a face covering. The procedure for putting on a face mask is to first wash your hands, then put on the mask. Avoid touching the mask at all after putting it on. When removing the mask, remove it by touching only the straps, and after removing the mask, wash your hands. Disposable masks should only be worn once. You may also wear a simple cloth-based face covering or a plastic face shield. If you are using a cloth face covering, it should be washed daily or a new covering worn daily. Have a bag or bin to keep face coverings in until they can be laundered with detergent and hot water and dried on a hot cycle. If you must readjust your cloth face covering while wearing it, wash your hands immediately after putting it back on and avoid touching your face. Discard cloth face coverings that no longer cover the nose and mouth, have stretched out or damaged ties or straps, cannot stay on the face, or if they have holes or tears in the fabric. Plastic face shields must be sanitized after each use. In general, the wearing of disposable gloves during the day is not recommended. Gloves should only be worn for the duration of specific tasks and disposing of gloves at the completion of the specific task. Use disposable gloves or rubber gloves for any form of sanitizing or disinfecting to protect your hand from chemicals. As always, gloves should be worn when performing daily health checks, changing diapers, cleaning up blood, handling dirty laundry, and cleaning other potentially infectious materials such as vomit or diarrhea. Best practice is that if you're cleaning anything or changing a diaper, remember to have gloves on. Taking disposable gloves off the wrong way could put your skin in contact with the germs on the outside of your gloves. Remove your gloves safely every time. Start by rolling the first glove off the hand, turning it inside out in the process. While holding the now empty glove in the gloved hand, grasp the empty glove in the palm of the gloved hand and roll down the glove from the second hand, only touching the inside of the glove, rolling the glove inside out. Touching only the inside of the glove, now outside, throw the gloves away and immediately wash your hands. Hand washing as a practice is very important for both staff and children. Regular and proper hand washing can prevent many illnesses and diseases, including the common flu, norovirus, rotavirus, pink eye, salmonella, and E. coli. It can even prevent spreading of COVID-19. The CDC tells us that hand washing is the single most important means of preventing the spread of most infection. By washing our hands, we can prevent both direct and indirect transmission of disease. We should take 20 seconds to wash our hands each time. There are many parts of our hand that we may think we wash, but we actually aren't getting to. When you wash your hands, pay attention and notice what areas you are applying soap to and scrubbing. Take care to wash your thumbs, your fingers, under your fingernails, in between your fingers, the back of your hands, the palm of your hands, and your wrists. In some circumstances, hand sanitizer products with 60 to 95% alcohol content may be used as an alternative method to hand washing when soap and water are not readily available. You can tell if the hand sanitizer contains at least 60% alcohol by looking at the product label. Hand sanitizer must be stored out of reach of children when not in use. Washing hands with soap and water is the best way to get rid of germs in most situations. Staff and children must always wash their hands before and after eating, preparing food or bottle preparation, before and after administering medication, after using the restroom or assisting children with toileting, before and after diapering, after cleaning up bodily fluids, after wiping nose, cough, or sneezing, after each entry into the classroom, upon entering the child care facility, and if staff is moving in between stable groups or cohorts. So if you notice, the bottom four all have asterisks on them, and these are the activities where hand sanitizer is approved as an alternative use. The top 5 will require hand washing. Social and physical distancing requires the intentional creation of physical space between individuals. We know that it will be challenging to maintain social distancing in group settings with toddlers and preschoolers. Until requirements change, both states have set preschool classroom limit to 20. The ratios for infant and toddler classrooms will have a maximum size of 8 children. Even though we can have 20 children in a classroom, we will be limiting that class size to 10. To help fill the caseload, we'll be offering virtual services to the remainder of the slots in the classroom. One important change to all age groups is that children must be maintained in stable groups. Children assigned to one class at the beginning of the program should stay in the same group of children throughout the day and the duration of the program unless a permanent reassignment to another class is made. Classes may not be collapsed into each other even when ratios are maintained. Teaching staff who are assigned to a class should also stay with the same class each day, and efforts should be maintained or be made to provide the same floater and staff for the same stable group each day to the extent possible. These stable child groups should use the same physical space each day. Additionally, stable groups may only use any one shared space one group at a time. The most commonly shared spaces include outdoor play areas, indoor gyms or recreation spaces, and bathrooms. Sharing of the shared spaces need to be planned for, taking into account the spaces available and needed. Sanitization practices must be implemented for shared spaces in between uses by any members of different groups. Family-style meal service with self-service from a communal bowl and close companionship and conversations is a hallmark of snack and meal times at our agency. But until further notice, family-style meal service is suspended. Social distancing should be maintained to the extent possible. This might be accomplished through staggering meal service or spreading out the service area. In addition, contact with food and serving utensils should be minimized. This can be accomplished by having one staff member plate each child's meal in the classroom while still offering them each component. Following meal times, follow regular cleaning protocols with the disinfectant that is active against COVID-19. Toothbrushing is an important activity, and for many years, this has been a daily routine at our agency. At this time, practicing toothbrushing is not allowed at our centers. This is to help reduce the possibility of the spread of germs in our shared environment. Please encourage parents to practice regular toothbrushing at home. When you speak with families, ensure that they have the resources they need, such as toothbrushes and toothpaste, for all of their family. Have a conversation about toothbrushing, such as how much toothpaste to use and how long to brush. Ask if they face any obstacles with their child's toothbrushing and provide helpful information and resources as needed. We still have our dental screening scheduled for October, and we will be sending home toothbrush, toothpaste, and floss with every child, whether they have virtual or center-based services. So I want you to talk with your group or your team that you're sitting with about how else we can promote the oral health at our centers. And I have this slide here where you can put your ideas.
Ellie, you have a number of questions in the chat box.
Oh.
So I'm not sure when you want to answer
Okay.
those people sitting there.
Yeah. Oops. Hold on. There we go. Okay. Are bikes allowed, and are we able to use helmets? Bikes are currently allowed, but we are not using helmets at this time. And then are we allowed to use blocks? So the wooden blocks are not able to be used at this time. I know that most classrooms have those wooden blocks, but we can't sanitize them very well. If they have any sort of coating on the outside that's easily wipeable with a disinfectant, then you can use those blocks, but not the wooden porous ones. Disposable masks should only be used once. So they should be, the disposable ones should be changed after lunchtime, is what our procedures currently state, but that is not for the reusable ones. My training last year, they told us that hand sanitizer is considered a medication and you have to have a note from the parent to use it on the child. So in the past, childcare licensing has not allowed us to use hand sanitizer, but they have lifted that as a temporary exception for these circumstances. So we can use hand sanitizer on the children going forward. What happens when you can only fit 9 students at a time on the bus due to social distancing? There is a training this afternoon about, or tomorrow, with Wendy and Freddie about transportation, and we'll go over that a little bit more later in this one. But you should be able to fit at least 1 child per seat. Oh, Wendy, we will go over that in our break. There you go. So we are allowed the child to ride the bike without helmets. So yes, that is something that Velvet has approved and wants to push for, is not using the helmets since we can't sanitize them very well at this time. And then we have lots of ideas about toothbrushing. Take a sip of water after eating. That's a good idea. Include a toothbrushing song at circle time, and give that song to families, and encourage parents to take kids to dental. Yes. Yep, and send home information about toothbrushing. Okay, I'll give you guys another minute. I have many toys that are wooden, like the blocks, so I have to take those out too. So the wooden ones without the coating, where it's just the wood, can't be cleaned and will have to be removed. Yep, send toothbrushes home, and we will be doing that in October, and encourage our early Head Start home base to attend dental screenings at their sites. And toothbrushes are being sent home. What's the easiest way to clean floor puzzles? It depends on what they're made of. So if you can clean and just spray with a sanitizer, that would probably be the easiest. Cardboard. If they don't have a good coating on them that can be wiped, they might have to be removed. That's something that you can discuss with your area manager and center coordinator. We also have those big teeth and toothbrushes to demonstrate and talk about oral hygiene. I think they're called big mouths. Okay, so I'm going to keep going, and we will continue to answer questions at the end and as we keep going. So, as a part of the strategy to limit the spread of COVID-19, entry to the centers will be limited. This will apply to non-essential visitors, volunteers, and parents who normally have open invitation to visit their children's classrooms. For as long as it is required by state guidelines, centers will not be open to these visits. Each center will set up a location for families to drop off and pick up children, encouraging physical distancing between families and ensuring that necessary sign-in and screenings are conducted. Centers may stagger arrival and drop-off times and put in place other protocols to limit contact between families and with staff. It is important that this information is shared with families as early as possible and is supported in ongoing practice until such restrictions can be lifted. Signs can be posted at the entry of the center that reinforce for families and other potential visitors, including any delivery service, that only essential personnel will be admitted into the center. Staff members will bring children into the building and take them to their class, and at the end of the session, staff will bring children from their classrooms when parents are present to pick them up. There are a couple exceptions that will be made to the limited entry requirement. This includes, but is not limited to, breastfeeding mothers, parents who have a concern regarding the health and safety of their child, or parents who are assisting their child who have special feeding needs. All parents who enter the facility will be required to wear a face covering and follow hand hygiene and physical distancing requirements. If a child has a higher risk of severe illness, request that the family consult with their medical provider about the child returning to childcare to ensure that they have the proper supports in place for that child. This might include modifications of an existing care plan or putting a new care plan in place or any other necessary actions. Remember to discourage parents from sending their child when they are sick. It is best if the staff-to-child ratio always allows for one staff member to take a break without having to bring another individual into the small group space. If that is not possible and a float person is brought into the room, consider timing bringing in adults who are not normally part of the group to minimize close interactions with children. For example, give staff their lunch break during children's nap time so the float staff can remain 6 feet away from children while they rest. Or give 10-minute breaks when the children have just started a new engaging activity that does not require much adult interaction. Or you can give breaks when the group is having outside time where the risk of transmission is lower. Staff who are taking breaks should still keep a physical distance of 6 feet from other staff. Infants and toddlers need to be held. To protect themselves, childcare providers who care for infants and toddlers should wear a long-sleeved, button-down, or oversized shirt over their clothing and wear their long hair tied up or back. Change the outer layer of clothing if the body fluids from the child get on it. Change the child's clothing if body fluids get on them. Place the soiled clothing in a plastic bag until it is washed. Wrap infants in a thin blanket when you hold them. Childcare providers should wash their hands and anywhere else the child touched them, such as their neck or arm, after holding that child. So now we're going to talk about home visiting. So home visiting will be conducted virtually for most circumstances. However, there is some flexibility for in-person home visiting when counties move into different phases. So these are all the phases of Oregon and Washington. They're named a little bit differently, so it can be a little confusing. Since Oregon has a baseline where Washington calls it phase 1, and then it keeps going. So for the first 2 phases, there will be no home visiting. And I believe that both Washington counties are in this phase 2. So all home visits should be conducted virtually. In Oregon, I think that we're all in phase 2 here, so we can do outdoor visits, and we'll talk about how we can conduct those. And then as we move forward, we can do in-home visits based on the clinical discretion of the home visitor, supervisor, and family. When home visiting is able to be conducted in person, staff will travel individually to the home and no carpooling should occur. If possible, contact the family on the day of the visit and ask our health screening questions, which we will go over here shortly. Results of the daily health screening will be documented on the parent information section of the home visiting form. So it's at the bottom of the form and there's a couple lines from parent information and you can write down the answers to their health screenings. Staff and families who are participating in the home visit will use hand sanitizer at the beginning of the visit unless the child is under 2 years old. Home visits should be conducted with face coverings worn by staff, adults, and children over 5 years old. Physical distancing, performing frequent hand hygiene, avoiding touching the eyes, nose, mouth with unwashed hands, facial coverings by home visitors and family members, staying home when sick, and avoiding being around sick people are the most important basic precautions. Maintaining physical distance when providing a home visit with families may be difficult, especially when families with toddlers and young children and when residential spaces do not allow for physical distancing. To the extent possible, home visitors should maintain a distance of at least 6 feet between themselves and family members during a visit, and if possible, the home visit can take place outside. Group socials. At this point, they will only be held virtually. And in-person group socials, indoor or outdoor, are suspended. And you guys can be really creative and ask input from your families on how you can still get those incorporated into your program year. International traveling. So staff and families may have been exposed to COVID-19 during their international travels. They may feel well and not have symptoms, but they can be contagious without symptoms and spread the virus to others. Travelers pose a risk to their families, friends, and communities for 14 days after you were exposed to the virus. Encourage the family to keep their child home for 14 days to monitor for symptoms before coming back to class. So we can't require them to stay home for 14 days, but we can encourage them to. Now we're going to move on to daily arrivals and departures. Ideally, the same parent or designated person will drop off and pick up the child every day. If possible, older people such as grandparents or those with serious underlying medical conditions should not drop off or pick up children due to the risk for severe illness from COVID-19. Each center will set up a location outside the center for families to drop off and pick up children, encouraging 6 feet of physical distancing between families and ensuring necessary sign-in and screenings are conducted. Centers may stagger arrival and drop-off times and put in place other protocols to limit contact between families and with staff. Families will be asked to wear a face mask during drop-off and pickup. If they do not have one, we can provide them with a disposable mask. Create a plan for receiving families and aim to encourage to move through one continuous direction that supports social distancing. Consider using signs or markers to guide people, such as using tape or sidewalk chalk to mark where families and staff members should stand. Consider posting signs to help people know the procedures and where to go. Designate one or more staff members to walk children to their classroom, and at the end of the day, walk the children back outside. Have hand hygiene stations that should be set up at the entrance of the center so that they can clean their hands before they enter. If a sink with soap and water is not available, provide hand sanitizer with at least 60% alcohol next to parent sign-in sheets. Keep hand sanitizer out of children's reach and supervised use. You can use baby wipes if the child is under 2 years old. All children's hands will then also need to be washed when they have entered the classroom. Infants can also be transported in their car seats, but we will store the car seat out of children's reach. So bus transportation, when they do parent drop off and pick up, buses are not to make on-street stops. They must stop, the stop must have room for the bus to pull off the road and room for staff to provide health screenings outside of the bus. Have staff members greet families outside of the bus as families arrive. Limit direct contact with parents as much as possible, and practice 6 feet of physical distancing at all times. Staff will use hand sanitizer between each bus stop. Children should have assigned seats that are the same for pickup and drop-off. When placing children in bus seats, consider factors such as children from same families, children who share housing, and children from the same classrooms. Plan on how children will be unloaded and loaded according to classrooms and following assigned seats. Designate adequate staff members to walk children to their classroom and walk children back to the bus at the end of the day. Practice 6 feet of physical distancing at all times. Have children wash their hands as soon as they get to their classroom and before they get on the bus. To keep minimal contact with items that come from home and to prevent the spread of the virus, children's toys or backpacks will not be allowed on the bus. At the end of each bus run, the bus will be cleaned and disinfected, including all car seats and seat belts prior to the next routing. Chlorine and ammonia-based cleaners are not to be used on the buses. Drivers and passengers should maintain physical distancing whenever possible. No one who is ill should be on the vehicle until their health status can be determined. So now we'll talk about the daily health screening and attendance. So staff, children, and all adults entering the center are required to take temperatures daily upon arrival at the center and answer these questions. Has the adult or child been exposed to a person with a positive case of COVID-19 in the past 14 days? Has the adult or child been exposed to a person with a presumptive case of COVID-19 in the past 14 days? A presumptive case means the person with the that was exposed to someone with COVID-19 and the presumptive adult or child showed symptoms in the past 10 days. If they answered yes to either question 1 or 2, the child or adult must quarantine for 14 days. The 14-day quarantine starts on the day that the child or adult last had contact with the COVID-19 case. Question 3. Is the adult or child experiencing unusual cough, shortness of breath, or fever? An unusual cough means something not normal for this person. If they have asthma or allergies, that could be a usual cough. If they answer yes to question 3, that person must be excluded from the program for 10 days and 24 hours of symptom-free. With regarding to the cough and shortness of breath only, If the person has been checked by a medical professional and is cleared, they can remain in or return to the program following the documented direction of the medical professional. Anyone with a fever of 100.4 degrees Fahrenheit or higher is excluded. And we do have a chart on exclusion and returning to care in the next couple slides. And the last question is, does the child or adult have symptoms of diarrhea, vomiting, headache, sore throat, or rash? If they answer yes to question 4, that they must be excluded as follows. If they are seen by a medical professional and is cleared, they can remain in or return to the program following the documented direction of the medical professional. If not seen by a medical professional, they may return 24 hours after the resolution of symptoms. And we're going to document that daily health check was completed on every person entering and write down pass fail only. We will not record any symptoms or temperature in order to maintain privacy. So for staff and adult sign-in, staff with a temperature at or above 100.4 degrees Fahrenheit, or if they answer yes to any of the screener questions mentioned previously, will be asked to go home and follow the exclusion procedure. If the staff does not have a temperature or any symptoms, they are cleared to enter the center. They will document their arrival and departure time from the center on the staff and adult sign-in and initial that they do not have any symptoms under the health check completed column. When the staff or adult sign out for the day, they will need to confirm that they have sanitized or disinfected their personal space or space they visited under the sanitized area visited column. Gloves and masks are required for staff completing the health screening for children. If you use a disposable or non-contact thermometer and did not have physical contact with the child, you do not need to change your gloves before the next health check. If you use non-contact thermometers, clean them with a disinfecting wipe or paper towel sprayed with sanitizer between each child. You can reuse the same paper towel as long as it remains wet. Children with a temperature at or above 100.4 degrees Fahrenheit, or if they answered yes to any of the screening questions, will be asked to go home and follow the exclusion procedure. If the child does not have a temperature or any symptoms, they are cleared to enter the center. If the child passed the health screening, staff will sign in the child on behalf of the adult, dropping them off by utilizing the daily attendance log and document as follows. Writing down the time they arrived at the center, write the name of the adult dropping the child off, and initial the health check completed column. If the child has symptoms from the health screening, document on the daily attendance log as follows. Place an E on the daily attendance log in the in column. So we're going to still write the name of the adult who brought the child for contact tracing purposes if needed later. And we're going to follow the exclusion procedure. And then we're going to explain to the adult why the child is being excluded and under what conditions they can return. Facilities must keep daily logs for each stable group to support potential contact tracing. Daily logs must be retained for 2 years. Each daily log needs to indicate the child's name, arrival and departure date and times, and the number of hours that the child was in care, adult's name, completing drop-off and pickup, and no signature is required, name of any staff or person coming in contact with a stable group, arrival and departure date and times, and a documented health screening on all children, staff, and any person coming into childcare. Encourage parents to have more than one person on their permission to release with updated phone numbers so they can be readily contacted if a child needs to be sent home. If a child develops a cough, fever, or shortness of breath that can't be attributed to a pre-existing condition, isolate them away from others immediately and send them home as soon as possible. If a child has recently had a fever or cough, encourage families to seek testing for COVID-19. Exclude children and staff who have had contact with people exhibiting symptoms of COVID-19 or who have a presumptive case of COVID-19. Encourage these staff and families to be monitored carefully for symptoms. Each center must have a designated sick child area where they can separate a child from others. While waiting for parents to pick up a sick child, caregivers should stay with the child in a room isolated from others as a part of our active supervision guidelines. All staff members assigned to the sick child area must wear a mask or face shield and gloves while taking care of a sick child. If a child has a fever, cough, or shortness of breath, the caregiver should remain as far away as safely possible from the child, preferably 6 feet, while remaining in the same room. We know that that might not be possible. Staff who are at a higher risk of getting COVID-19, for example, those over 65 or with underlying health conditions, should not staff the sick child area. After each use, the sick child area should be cleaned and aired out and sanitized and disinfected following our current protocols. If anyone who has entered the facility is diagnosed with COVID-19, report to your area manager. The area manager and the health manager will consult with local public health authorities regarding cleaning and closure. Communicate in coordination with local public health department with all families and other individuals who have been in the facility in the last 2 weeks. Always consult with the local health department around any written communication that is developed to notify parents about disease outbreaks, risks to students, families, and staff, and or measures that are specific to the outbreak. So this is a really helpful tool that ODE came out with. It's an exclusion summary, and this gives you each of the scenarios and when the child can come back. So if they answered yes to some of the questions in the daily health screening, this kind of gives you a step-by-step on what to do and when they can come back. So if they have a fever, an unusual cough, or shortness of breath, they must be sent home. And that's when they have to be home for 10 days and 24 hours of symptom-free. They can get tested. If they test negative for COVID-19, they may return 24 hours after the resolution of the cough and they're fever-free. And if a medical professional advised the person that they can return to care, they can return following the documented advice of the medical professional. If they have symptoms of diarrhea, vomiting, headache, or sore throat or rash, they must be excluded. And if a medical professional advises the person that they can return, they may return with documented advice. If they haven't seen a medical professional, they can return 24 hours after their symptoms resolve. If a child or staff member has been exposed to someone with a current presumptive or positive case, they must quarantine for 14 days and start counting from the last time they had contact with the person who does have the presumptive or positive case. For presumptive only, if the exposure was to a presumptive case of COVID-19, exclusion is required only if the child or staff member was exposed in the 10 days after the COVID-19 presumptive person started having symptoms. This would be the period that would be infectious. And the health department is going to help a lot with some of these more difficult ones. And then if they develop symptoms at the facility, we'll separate the child or staff member and send them home. And if they have a household member with symptoms, we can carefully monitor the child for symptoms and encourage the ill household member to get tested, but we cannot exclude that child. So FHA staff will continue to work with parents to ensure that they have access to medical care. Refer families to medical provider for COVID-19 tests if their children has a fever, cough, or difficulty breathing. After the exclusion of a child, their FHA should follow up on a regular basis to monitor the health of the child as well as to support the return of the child to the center once they no longer fit the exclusion criteria. Working with families continues to be a key part of our approach and service. While conditions dictate that we should be open to currently enrolled children and essential staff, parent entry to buildings must be suspended. While these restrictions are in place, it will be particularly important to use available means to create and maintain supportive relationships with families. Initial conversations with families should include a discussion about changes to services and safety practices that we have implemented prior to enrollment. If possible, prior to intake, take time to make sure that parents understand what steps the center is taking to protect their children. Share prepared information and familiarize families with what to expect on the first day of center drop-off or bus pickup. We have provided you with a letter to give to families. And that was sent out to our parents in the summer program, and there's a couple updates that will be sent out also. When masked, maintain social distance to the extent possible and greetings families in person. It is important to remember that masks and distance can make it hard to express welcome and support. Pay close attention to body language using open posture and gestures. Speak slowly and clearly as possible to be understood. It continues to be important to connect with families to assess needs, set goals, make referrals, follow up on child progress, and more. Arrange with families for the best means of communication while physical distancing is required. Use emails, texts, video conference, or other tools to stay connected. For most people, COVID-19 will be associated with increased uncertainty and stress. While we are under acute stress, we are more likely to be operating from the survival areas of our brain, which means that our thinking becomes much more black and white and our attention is more narrowly focused on the immediate here and now. We start to have difficulty planning and thinking ahead. We also have difficulty regulating our emotions, and we become less able to make decisions. Stressful times are associated with threats to our safety and loss of power and control. If we as adults are experiencing this type of thinking and feeling, imagine what a young child may be experiencing. Our priority should be to establish a safe, secure, and nurturing environment, focusing on positive staff-child relationships and modeling positive staff-staff relationships. In uncertain times, having any amount of certainty or predictability is helpful. Communicate and check in with each other daily and make plans for self-care within your workday. Take breaks when needed and consult with your supervisor often. So while much of our work to provide children and families with high quality early childhood education, care, and advocacy with unique and supportive services is the same as we move forward, we also know that we are moving forward and providing services within conditions of uncertainty. We hope to have provided a high-level overview of things which will be the same and those which will be different. Because programs, facilities, and resources in each site are different, and because the needs of each community are different, there will be differences in how each site will be implemented program running under these guidelines. As an employee, it is important for you to work closely with your supervisor and site management to make sure that you are aware of site-specific differences and implementing practices accordingly. Your Mid-Columbia Children's Council management team and resources at Central Office are here to support you. Please don't hesitate to ask any questions.
And you do have quite a few questions in the chat box when you're ready for them.
Okay, let me see if I have where my last one was. Okay, at registration, we should document that states there is a chance that their child could get COVID-19 from our buses, centers, and staff at the MCCC Head Start, and its employees are not liable. That's a good idea. I will write that down. Actually, I'm just going to take a little screenshot of it. It's faster. If it lets me. Oh, there we go. Oh, I don't know if it's going to let me. Okay, 1 second. Oh, I did get it. Okay. Let's see. The next question. Does the no carpooling rule apply to canvassing and recruitment? This is usually done in pairs. Yes, I would recommend that no carpooling should be happening at all, because you can't really maintain your physical distance. That was a good question. If a child shows up with a cough or cold, what is the protocol? Do they need a COVID test to return or a doctor's note? So following that flow chart, they don't have to have a COVID test, but they will be excluded for 10 days without one. Next question. If the child stays home for 14 days after travel and are they safe from being dropped due to attendance? Yes, they would be. I believe Karen Porter can correct me if I'm wrong. but I would think that that would be a yes. Because we can still do virtual services for them while they're quarantining. Not all stops have a place that we can pull off the road. What would we do in that case? Also for drop off, we will be able to use on the road stop because we'll not be doing other health checks at drop off times. Wendy, you can go over that with the other Wendy during your training this afternoon on what to do in those circumstances. She will have a little more information.
That's all stuff we'll go over.
Okay. Yes, I can email. A lot of this stuff has been posted on the internet, and I will also be posting this video on YouTube, and I can send out the link afterwards. Heidi says you can also check in with her if she needs it. Paula, tips for sanitizing blocks. Obviously, we can wipe the outside. Do we need to worry about the insides? I guess I'm not clear on that question. About the inside of the block.
Books, inside of books.
Books. Okay. Sorry, sanitizing books. Thank you, Emily. I am going to say if we can get those ones that aren't necessarily just paper and they're a little more, they have that coating and they're harder, those would be easier to clean. But if you can just wipe the outside, we can also just make sure that they wash their hands before they touch the books. Got a thank you. Books. Thank you, Paula. Follow-up children with asthma and allergies. We'll be accepting doctor's notes at the start of the year to cover those children. Yes, they will be having, if we have a protocol that is signed, there are doctors clearing them to be in class, and it will still follow our medical protocol procedures. And I am 10 minutes early, so if anybody has any additional questions, now is your opportunity. I'll give you guys just another minute.
Did you say that you would be sending us the hard copy form of this through email or something?
The procedures?
Yes, yes. I had to step.
Those will, yeah, I can send them in an email. They're also
Okay.
going to be posted to the intranet.
Perfect. Thank you.
It's a safety procedure, so you find it under the SF section.
Okay, thanks.
Okay, I'm going to go ahead and stop the recording because we'll talk about what's going to happen next.